Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst, and my co-host and a couple guests with us today.
Hey guys, Faraday Golombieski, nurse practitioner here at RevitalyzeMD, and we'll just go around the table.
Hi, I'm Marissa Staten here, obviously with RevitalyzeMD, medical esthetician and laser technician.
And then our special guest.
Yes. I thought y'all were going to announce me for
Oh, yeah.
No, I'm Mark with InMode. I'm a brand manager covering the whole state of Tennessee and y'all's loyal servant for all things InMode.
I like that.
Yeah.
Loyal servant.
Yeah.
That's
Get
nice.
the champagne going. I start saying it.
I love it. Well, and thank you for coming.
Of course.
And
Thank you for
spending
having
the
me.
afternoon with us and doing some podcasts and talking about all the great services that InMode has.
Appreciate y'all having me.
So we did do another podcast on Morpheus 8, which is RF microneedling. And so if you haven't seen that one, then we encourage you to check that one out because we talk about Morpheus 8 and all the benefits of that. But this one is going to talk about Morpheus in a specific treatment of stretch marks that we combine Morpheus 8 or RF microneedling with a different service. So that's what we're going to talk about with this one. Marissa will kind of bring into it, but again, we like to hit hard to treat areas, and stretch marks is absolutely one of those with multiple modalities because we can heat, we can stimulate collagen elastin a little deeper, then we're also hitting it from a different angle. And the benefit of combining treatment and the results are just fabulous. And so,
Absolutely.
again,
Just trying to be super comprehensive
Yes.
as much as we can within our practice.
Yes.
And
Combination
not everybody
therapy.
is lucky enough to be able to do that. And we are.
Absolutely, where you can, have the experience of Marissa, who's been doing lasers for almost a couple decades, but not quite, but just under. But she's fabulous. And again, to know the science behind, and Faraday and I be able to work with her and with the companies to kind of just target the benefits of a specific treatment and how we can combine and then not cause problems. And then to get the results we've been getting with this. And stretch marks are just one of those areas that don't go away.
Absolutely.
And a lot of women get them, or men actually, even with weight gain and
Absolutely.
weight loss. And there's
We
actually
treat lots of men, so we don't want to leave the guys out
Yeah,
on
No,
this one.
don't discriminate on us there.
No.
We still want more for
Yeah.
these treatments.
no man left
No
behind.
man left behind. That's our motto here.
No
And all
man-
things.
On all things, yeah, no man left behind. Because again, I would almost say that almost everyone has stretch marks somewhere. Whether it be weight gain on a hip, on a
After
leg,
breastfeeding.
abdominal area, and then again, obviously with pregnancies, you get that too. So, yeah.
Absolutely.
So there's lots of
thighs.
lots of different areas. But you can't really get treatment of stretch marks to the point where you get resolution that they're happy and outside of excision and surgery, and we've gotten fabulous results. And so let's talk about that a little bit. So Marissa, even combining, if you want to talk us through the couple different treatments and steps for RMD treatment of stretch marks.
My favorite treatment is, and I actually created this, I added a 1064 nanometer wavelength first before I did the Morpheus 8 and the reason I do that is the 1064 goes very deep into the dermis, creating some photobiomodulation, and then we're going to do the Morpheus RF microneedling on top of that. And then you're hitting the stretch marks, many different levels, you're building collagen elastin, and you're going to help obviously with the scar tissue and break it up and create newer, fresher looking skin. And it's going to tighten, firm, maybe kill fat if we need to, and it's just the skin in the area is going to look so much better.
And we're going to add some before and afters at the end of the podcast, so definitely stay tuned so that you can see those because we've had some fabulous results.
So if you're listening, you may not be able to see them, but I would refer you over to the YouTube channel, to the video, because we do videos of all the podcasts. Then you'd be able to see the before and afters of the stretch marks.
Seeing is believing, especially
Seeing
with
is
body
believing,
treatments.
yes.
Yeah.
And we do have them on the website as well. And so when she's talking about wavelengths, lasers will come different wavelengths. And again, depending on the wavelength, you get a different depth of penetration. And you get that with RF microneedling too. And so almost everybody probably has some fat to kill with the stretch marks. Very few that don't have, because you want to tighten that skin at the same time. And so that 1064 is a wavelength that just goes a little bit deeper. like Marissa said, heats it up, and then that biophotomodulation, such a big
Ooh,
word.
I know. I was
Yeah.
really
Talk a little-
impressed.
I
That
know.
went right over my head. I'm
Rolled
just gonna
right
be
off the
honest.
tongue.
So
Yeah.
maybe like explain that one to Mark, because that one is like one of those wavelengths that goes a little bit deeper. And again, RF microneedling, especially on the body, you can go deeper, and we'll talk about that depth of penetration. But what is the photobiomodulation of which you speak?
In a nutshell, the photobiomodulation with a 1064 nanometer wavelength is going to go deep enough into the dermis that it's going to bring the stem cells to the area to build collagen, heal itself for the most part, create more repair, and it just works its way out and to show up through skin.
Yeah.
That's the best way for
And
me to
what I
describe
think-
It's
it.
a really
I think-
fancy word to say it makes everything better.
Yeah,
just
it makes
makes
everything better.
I'm sold.
Yeah.
That's all I needed to hear.
Yeah. So you're using
Then-
light energy,
Yes, light energy.
through laser to stimulate stem cells and make everything brighter and tighter.
Brighter, tighter.
Yeah.
Brighter,
That's
tighter.
what we're looking to
Yeah.
achieve.
Yes,
Absolutely.
absolutely. The end goal of everything. And so then so now the tissue deeper, I'm guessing, is more is heated, and now you're going to go ahead and add more energy with the RF microneedling. And so when we talk about body and potentially how deep you can go with Morpheus face versus body, you can go up to
7 millimeters of depth with a different handpiece. But right now we're going to 4 millimeters. Granted, with that heat energy that's going through the skin, and again, this is not the same tip, but once those needles are penetrated, the energy is bouncing from the top of the needles down to that little grounding pad right there. So you're actually going to get an extra millimeter of heat profile to cause even more skin tightening, skin contraction, resurfacing, all the things that you want to get rid of that cellulite or stretch marks that we're trying to target.
So if like you're doing a face, there's different hand pieces you can use, and different surfaces. Like the face one, you're going to go 4 millimeter max. If there's a fatty area under here,
Usually
you could
targeted
go.
on the maybe
you
the
could go-
cheeks, mostly around the neck,
Underneath.
chest,
Mhm.
exactly.
And then body could potentially go up to 8 or 7 if you're using a body piece.
So the actual needles are going to
knows where this is
penetrate.
going,
Yeah,
right?
so
Yeah.
I've been waiting for this, but yeah. So the
Yes.
actual needles themselves are going to go to 7 millimeters of depth, but
Okay.
because you're getting that extra millimeter of heat profile, you're getting
The punch,
8
the
millimeters. The punch, yes.
Yeah.
You're getting 8 millimeters of penetration at the end of the day, and that's going to cause even more skin reaction, which
Yeah.
is what we're looking for.
Yeah, it's a little tweak and twist, like definition. So basically, the depth of penetration being one thing to 7 millimeters, but the pump of
pump.
energy a little bit
That
further
push,
than
that
that.
little
Yeah.
extra.
So
Guys, you know what we're
actually-
talking about here, right? That little
exactly.
extra.
Yeah. So ultimately,
Make it count.
you're make it count.
Yeah, we're going to make it count.
Oh, always.
So the energy penetration
Or
is up to 8 millimeters. So again, then you're talking about fatty tissue. And so now you've already heated it with a different modality. And now we're doing the RF microneedling potentially, on the body, you could go up to 8 millimeters of energy penetration. Safe to say, right?
Very safe to say.
Pump of energy beyond the depth of penetration. Right?
And and you're actually
Yeah.
going to get into that adipose fat at that point as well. So when you're looking to get that fat destruction as well, combining that with that skin tightening, the laxity reduction, that's when you're kind of finishing the portrait that we're trying to paint.
Yeah, yeah.
So, have you seen these results? Because we see them in our office. Have you seen them?
So I've actually had a handful of patients on body treatment, specifically around the thigh area above the knees, which is just, that crepey skin. There's really no good solution for that. There used to not be. Morpheus, and again, combining with y'all's other therapies, I think really targets that specific indication very well. Cellulite is another great targeted body treatment. On most people that have stretch markers a lot of time might have cellulite as well. You're able to target both of those different indications. And postpartum skin laxity, I think, is one of the greatest body treatments that Morpheus can target, because most of those patients might need a mommy makeover, or actually have to go under the knife. If they're not really ready to do that, or maybe they don't even really need to, if you're able to target that area and actually tighten the skin without having to go out of office, that's a big win for y'all and the patient.
And so we have a lot of patients that come in that do not want to do surgery and don't want the downtime of surgery, don't want surgery. And again, I think that Morpheus 8, Morpheus Body are fabulous treatments at doing that non-surgical approach to stuff, because again, body contouring, even if you had excision of something, and the only time you really need to cut is when you have excess of something, but even
Skin usually
then,
being the thing.
yeah, the skin and fat being the thing, but a lot of times either they don't want to go under the knife, there's the expense, there's the downtime, but also some things that are surgical you actually need to address with other treatments later, and we've seen that a lot of times too. Like liposuction, for instance, it's not as smooth. It tends to be lumpy, bumpy, a little asymmetric, and so a lot of the treatments can help to smooth that
Make
out.
that
And
a little bit more symmetric.
yeah, and then cellulite, it's a hard thing too. Like again, it's liposuction, but I think that the non-surgical options for cellulite now
Are great.
are
Yeah.
I would say you'd almost
ridiculously
get a
good.
better result because you're actually getting resurfacing.
Yeah, ridiculously good. And I think anytime you undergo the knife, like you are going to potentially not get the results you want. And so if you can go a different route, which definitely with cellulite you can.
Absolutely.
And even that skin tightening postpartum, unless if it's excess fat and skin that you really need to cut off. And we like to combine again, like we love, the RF microneedling and Morpheus and killing the fat, but also combining it with, like a tight sculpting too, where you're just getting both realms, and so like you're doing it in different modalities, different approaches, and the results are ridiculously good.
The combination
So,
therapies, that's where it is too.
Yeah.
I
Yeah.
love doing that.
Yeah.
And I will say we've had patients with old stretch marks, so that we've seen amazing results with. So the patient I'm thinking of doesn't need liposuction, doesn't need to go international. She doesn't have a ton of excess fat. She's had her kids, she's living her life, she's lost weight, she looks great, but has these stretch marks that are 12, 13, 14 years old that have
Great
bothered her. She's
results,
done
yeah.
everything else. She's worked out, she's ate right, she's done everything, and that's kind of like the last piece for
Yeah,
her is
yeah.
these stretch marks that have been with her. And we've seen great results with that.
And with very acute ones too.
Exactly.
So
And
still
even-
dark
yeah,
in color and, and amazing results.
couple months post pregnancy. Yeah, postpartum where that purple has
Yeah.
changed color. It now looks flesh toned.
Yeah, amazing. Like, so again, the results that you can get now with non-surgical options. So even if we're talking about Morpheus and combining it with like the body FX, like the radio frequency, that reduction, skin tightening, a different modality, a different route, so
You can
the
combine
results-
those therapies with Morpheus and get them on a body contouring, scheduled maintenance to continue to build that collagen elastin, to continue to actually just get that body tighter or whatever that targeted area is. There's so many different things that y'all have in the office right now that
Yeah.
can treat so many different areas that y'all, patients are asking about.
Yeah.
Absolutely.
So-
So supporting it.
Yeah, and customizing treatment plans specific for you. So I think the best thing to do if you're ever considering body contouring, fat reduction, skin tightening, is to set up a consultation. And definitely, not everyone's here local, though we do treat a lot of patients that are remote that come in for treatment, but always to get an office that's going to be very comprehensive in your treatment plan, and potentially approach it from different angles and give you options to consider before you undergo a surgery at this point. I think the only time is really when you have to excise something, cut something off because there's way too much excess.
too much.
And
Yeah.
it's not a non-surgical option.
This is not surgery, but it's about as close to it as you can get without having a surgical intervention.
Yeah.
Absolutely. And I think that's such a good point because we have patients that come in and we want to set realistic goals, right?
Yes.
So we have patients that are like, I want to get rid of this. I'm like, well, that is surgery.
Or weight reduction
Or,
first. Yeah.
yes. And then we'll see you after,
Yeah. To build off of what they got from their surgical intervention.
Exactly.
Yeah. Or even like, again, we like to be realistic, and it's always about like treating yourself, rewarding yourself if, there's some weight loss circumferentially to lose. So around you have more, you're not going to be happy with the results for the amount of money you have to input to get them. So instead, set a target goal, some short-term, methods of getting
Lifestyle
it.
changes.
Lifestyle changes. And then reward yourself at the end with
Morpheus.
non-surgical.
I was about to say.
Yeah, non-surgical body
Sold
contouring
it for
fat
me.
reduction.
Thank you.
That's right. Yeah. I think that is anything else that you would say about like even the consult and things that would be specific for what a patient might need to do while they're doing it or after.
Definitely want to take a collagen supplement with the vitamin C. It's going to help stimulate more collagen. That's going to get even better result. Really, it's all in the consultation. I really need to see what's going on and what their main concern is, and we go from there. If it's a lot of loose skin, as they said, it's you really want to look at a tummy tuck or wherever that area is. But if there's just stretch marks and fat, we've got you covered.
So about how many treatments, how many sessions are you seeing on average? Thigh, abdomen, arms, just
3
different
is
places.
first and foremost. Everybody's going to need 3 treatments to get you where you need to be. Now, some people are going to need more treatments, and it's according to how deep their stretch marks are, how wide they are. There's, different ones, and that I would, talk about in a consultation. But 3 first, for sure. Everybody's going to need 3. 1 will be great if it's just fine, but you're going to need 3.
And then how
Getting 3.
I was about to say,
You're getting 3.
No,
Because you're going to stimulate,
well, truthfully,
but you want to keep the stimulation
exactly.
going.
If you want to continue to build on what you've already started, you want to get through the entire process.
Because it could stop. You want to keep it going.
Well, and
The
those
stimulation
yearly
goes.
maintenances are such an important part with anything non-invasive or minimally invasive because, like we talked about earlier,
Yes.
gravity is still going to happen. We are still going to age. So whatever you can do to not only correct but prevent long term is going to see the the greatest result for the patient.
there is no such thing as one and done.
No,
Well,
There is
nothing in life. Well,
no-
I take that back.
yeah.
Maybe.
Yeah,
But,
yeah.
but
Yeah.
for the most part, nothing is a one and done.
Yes, nothing. Well, yeah, I completely agree. But most across the board, like nothing in life is one and done.
There's a few
It
outliers.
might just
but I
you
can't
might be
think of
As
moving
an
on.
SI,
You
yeah.
may move on to a different
Maybe a few,
modality, but
but-
it's still not one and done.
Exactly.
But because again, so I think that series, that treatment series, is necessary, and then ongoing maintenance because it's cumulative. Everybody needs a treatment series. If you're looking to treat something, meaning you have stretch marks, you have fat reduction, you want done, you have body contouring, that's a treatment. That's not a maintenance.
Yeah.
Series of 3 at least to start. And depending on what kind of results, you don't want to get mostly there,
No.
still have a little to improve. So if you need 4 or 5, I would do it. And then you move to a maintenance after that.
I think as a
on-
patient, you need to expect a treatment plan. Right?
Right.
So
It's
go
not a
into
treatment.
any consult knowing there is a plan. It is going to be a series. It may be in combination. That's what we like to do here. Other offices may do
Right.
it differently in other states and different areas. But we like to be very comprehensive in all of our treatments for our patients. But expect a plan, a treatment plan. You're going to have a series that's going to be spread out. How far apart are treatments typically?
4 to 6 weeks. Body is closer to 6, 6 to 8 actually. And you want to make sure they're actually using good skincare on that area too, because we have some great body contouring products as well as cellulite control. So we have those to complement the treatments. But yeah.
So, and when we talk about comprehensive, again, our office strongly believes in comprehensive treatment plans, but also we can bring in, like, so if Marissa thinks that there's something else hormonally going on, Faraday and I will get involved in that because if you're going to invest in getting a result on body contouring stretch marks, a little different because that's geared towards one specific treatment.
Yeah.
But if there's a fat reduction and overall maybe there's a hormonal, interplay with weight gain. So we're doing the same things. We're eating the right stuff. We're working out the same,
All
but
of a
we're
sudden
still
we've
gaining weight.
gained
Yeah.
15 pounds.
Yeah.
So above the knees, behind the arms, the bra fat
bra
area
fat.
for women. And again, we gain in our midsection. If that's the case, then we may need to do some hormone testing and optimize hormones first. You're not going to build muscle as a man or a woman without testosterone optimization. And we don't do weight loss plans specifically, but we'll do peptides or something that actually gives your body back what it needs from a neurotransmitter or hormone standpoint to help you get the results that you want. And so we can combine those with treatments. And again, if you're wanting something improved, body-wise, body contouring, fat reduction, and you've reached a plateau and now you're seeking solutions, you want comprehensive solutions that are going to get you those results. So
Exactly. So as we talk about, we are investing in ourselves here,
In your
right?
health, your wellness,
Exactly.
overall.
So if we're putting the time and the money in and investing in ourselves, we want to see those results. So we need to stick with our treatment plans. I think that's probably the biggest thing is to kind of talk about is we have patients that'll do 1 or 2 and then not finish and then go, well, it wasn't, it was great and now it's not. Well, you need to complete your treatment plan for your best results and then you need to do your maintenance because as Mark pointed out, gravity occurs,
Yep.
we continue to age, we need to continue that process.
As someone with a lot of loose skin, I definitely want to recommend the peptide program with them for body composition, strengthen the skin, tighten the skin. That's going to complement the treatments even better.
yeah. And again, it's a progressive area of medicine. The peptides, hormonal optimization, you really need to go to an office that's very educated and comprehensive with their approach. But there's so many non-surgical options now. I think that from a facelift standpoint, from body contouring, from fat reduction, and skin tightening, all of it, there's
Everything.
such great non-surgical options that you definitely should get a good consultation, get some good
Find out what your
information,
options are.
and find out what your options are beforehand. So hopefully that makes sense. And
Yeah.
anything else you think we need to, anything we didn't think of?
I think
Depth of penetration,
I think
energy
everyone's excited
penetration,
to come
all
see
that.
all
We got
that.
it. Yeah. Well, good. So we really appreciate you coming on the podcast.
Thank y'all again. Seriously,
Yeah.
whenever
you
y'all
so
want,
much.
I'm
Yeah.
here.
Now,
Appreciate
make
it.
sure to get on to YouTube and look at our before and afters. We'll post those on the end and then refer back to our prior podcast on Morpheus to get a little bit of better understanding of just the Morpheus platform and what that looks like overall
yeah.
and all of its indications, not just stretch marks.
Yes, yeah,
1 of 10.
yeah.
There you go.
So definitely we appreciate you listening or watching. It helps support our channel and getting information out there. And like, subscribe, hit the button, share with friends, and comment any experience you have with stretch marks or inability to treat them or, Morpheus, RF microneedling, skin tightening, any of it. Let us know your experience and anything you want to hear about because we're here to revitalize your look, your health, and your sex life. And thank you, Marissa. I forgot to say thank you.
Thank
To
you.
you as well.
Thank
And
you,
Faraday's
Marissa.
always
I'm just here.
Faraday's
Thank
always
you.
here with me. So
Thank you, everyone.
thank you.